It's 3 a.m. Sarah, a second-year medical student, stares at her reflection. Her eyes are bloodshot, her face pale. The weight of tomorrow's anatomy exam, countless flashcards, and the pressure to succeed press down on her. This is the reality for countless medical students around the world. They must absorb vast amounts of information, master complex procedures, and navigate the emotional burdens of patient care. The constant pressure to excel, to be the best, can take a toll on even the most resilient individuals. But beneath the surface of their calm exteriors, many students are silently struggling. Sleep becomes a luxury, personal time dwindles, and the line between life and medical school blurs. This relentless pace can lead to burnout, a state of emotional, physical, and mental exhaustion. Mental health issues among medical students are a silent epidemic. Studies reveal alarming rates of depression, anxiety, and even suicidal ideation within this population. The very individuals training to heal others are often grappling with their own unseen wounds. Yet, there remains a pervasive stigma surrounding mental health in medical education. Many students suffer in silence, fearing that seeking help will jeopardize their careers. The culture of medicine, with its emphasis on strength and resilience, can inadvertently perpetuate this stigma. Students are often reluctant to admit vulnerability, worried that they will be perceived as weak or incapable of handling the demands of the profession. This fear of judgment can prevent them from seeking the help they desperately need. Untreated mental health issues can have a devastating impact on a student's academic performance, their relationships, and their overall well-being. It can lead to substance abuse, social isolation, and in extreme cases, even suicide. The fear of being deemed unfit to practice medicine is a powerful deterrent for many students seeking help. They worry that disclosing a mental health condition will lead to academic probation, loss of scholarships, or even dismissal from medical school. This fear is not entirely unfounded. While progress has been made in recent years, stigma surrounding mental health persists within the medical community. Some medical boards still require applicants to disclose mental health history, raising concerns about potential discrimination. This fear of professional repercussions can prevent students from seeking the help they need, leading them to suffer in silence and potentially exacerbating their condition. It is imperative that we address this issue head-on, creating a culture of support and understanding within our medical schools. Students need to know that it is okay to not be okay, and that seeking help is a sign of strength, not weakness. One of the most significant steps medical schools can take is to integrate mental health education into the curriculum. Students need to learn about the prevalence of mental health issues within their profession, the impact of stress and burnout, and how to recognize the signs and symptoms of common mental health conditions. By equipping students with this knowledge, we can empower them to prioritize their own well-being and seek help when needed. Furthermore, medical schools should provide easy access to confidential mental health services. This includes on-campus counseling centers, peer support groups, and partnerships with mental health professionals experienced in working with medical students. These services should be readily accessible, affordable, and free from stigma. When students see their professors and mentors openly discussing mental health, it normalizes the conversation and encourages help-seeking behavior. By creating a society that values mental health, we can encourage medical students to prioritize their own well-being without fear of judgment or discrimination. The mental health of medical students is not solely the responsibility of medical schools. It requires a collaborative effort from the entire medical community. Hospitals and clinics that provide clinical rotations for medical students have a role to play in fostering a supportive learning environment. This includes providing reasonable workloads, promoting work-life balance, and offering access to mental health resources. Senior physicians and mentors can play a crucial role in supporting their students. By sharing their own experiences with stress and burnout, they can normalize the conversation around mental health and create a safe space for students to seek guidance. Mentorship programs that pair medical students with practicing physicians who are trained in mental health awareness can be particularly beneficial. These mentors can provide support, guidance, and a listening ear to students navigating the challenges of medical education. The mental well-being of medical students is not a personal failing. It is a collective responsibility. By breaking the silence surrounding mental health, fostering supportive learning environments, and providing access to resources, we can empower aspiring physicians to prioritize their own well-being. Remember Sarah, the medical student from the beginning of our journey? Imagine if she felt safe enough to reach out for help, to confide in a trusted friend or faculty member. Imagine if her medical school provided her with the resources and support she needed to navigate the challenges she faced. By creating a culture of empathy, understanding, and support, we can ensure that Sarah and countless other medical students like her can thrive both personally and professionally. The journey to becoming a doctor is arduous, demanding, and often emotionally taxing. But it doesn't have to be a journey shrouded in silence and stigma. Let us break the silence, shatter the stigma, and create a culture of support that empowers future generations of healers to thrive.